And welcome back. Stem cell technology in the medical field is something we hear more and more about. In fact, I had stem cell injections in my neck after I broke it about 12 years ago, which made a huge difference. But stem cells and growth factors have also found their way into the cosmetic industry. And if you've been here for a little while, you know that I have been using a growth factor serum for a couple of years now. But just recently I started trying a different growth factor serum by Calecim. And I actually just recently made a video on the Calecim Advanced Hair Care System. If you have not seen that, I will link it down below. In today's video, we are talking to Ollie Tobin, a representative of Calecim, who will tell us all about the science behind their products, why stem cells and growth factors in skincare, are there any contraindications, and how to use them. Hi Ollie, thank you so much for being here.
Hi Claudia, thank you so much for having me.
Please introduce yourself and tell us just a little bit about Calecim and your work at Calecim.
Hi everyone, my name is Ollie. I've been working for Calecim, which is a subsidiary of a company called Cell Research Corporation. We're based out of Singapore. I'm an associate that's working for them at the moment, and I focus mainly on commercial partnerships under Calecim, but I also work for some of our other subsidiaries, which we may talk about later on in this call.
Great. Now tell us a little bit about what Calecim is.
Calecim Professional is the cosmetic arm of our parent company, Cell Research Corporation, who back in the early 2000s was founded by two scientists and a lawyer. Brilliant combination that we have there. And our main goal, Cell Research Corporation's main goal initially, was to find cures for unhealable wounds, something called chronic wounds. And up until then, there wasn't really a cure or an option for people to go to that wasn't really, really expensive and also quite time consuming. So in 2003, Cell Research Corp was founded on the basis of an incredible discovery by one of our founders. When his first child was born, he was looking at the umbilical cord lining and realized that there is a huge loss potential of something very special called stem cells, these certain type of cells that we'll talk about in a moment, within the umbilical cord. Now, stem cells were known. They've been found for a couple of decades prior, but they've been found in places like the placenta, the bone marrow, something called Wharton's jelly, another skin cell. You get stem cells from skin cells as well. No one had found stem cells from the umbilical cord lining, and that is the actual membrane that is around the umbilical cord. So they took that into the lab and they started to look at it. And it was only after a couple of weeks and months of investigating, they discovered how powerful and how strong a yield that the stem cells within that membrane was. Stem cell is a special type of cell that can differentiate into multiple different types of cells. It can also tell cells what to do. There are two main different types of stem cells within that umbilical cord lining: epithelial stem cells and mesenchymal stem cells. So the epithelial are the ones that focus on skin growth, the epithelial layer of the skin. Mesenchymal stem cells are stem cells that can differentiate into many different types of tissue, such as muscle, cardiac tissue, bone in some cases, and cartilage tissue. So Calecim was born slightly later than CRC. When we started our initial trials, our wound healing trials in America, they noticed when they were applying this conditioned media onto the wound that not only were the wounds closing very quickly, but the skin around the wound, which is called the peri-wound site, was really, really healthy. So one of our other founders, he was a plastic surgeon, he realized that there'd be an aesthetic benefit to this. So we capitalized on that idea, and out of that, Calecim Professional was born.
So the initial research was from human umbilical cord, correct?
Correct.
Okay.
So all of the work that's going on at the moment with CRC, our parent company, that is human umbilical cord lining. So it's using stem cells, live stem cells from a human umbilical cord. However, Calecim is not from a human umbilical cord. When we decided to launch Calecim back in 2017, we had the decision to make whether we wanted to go down the human route or we wanted to go down a different type of mammal route. There are only a few countries in the world that actually allow cosmetic, because Calecim is a cosmetic product, to be derived from human sources. We wanted Calecim to be an international brand, so we purposely decided not to go with human. We chose red deer, and people may think, oh, well, that's a deer. How is that going to work with human cells? How is that going to work with my cells? It's actually the fact that we are both mammals. The cellular messaging between our cells and our stem cells and the red deer stem cells is almost exact. So there is, almost no loss of messaging between the two different animals, despite them being two different species.
You and I have talked, and you assured me that this red deer was never hurt. Tell us a little bit about how you harvest this red deer umbilical cord, please.
It's an incredible process. When we were looking at certain types of animals to find their umbilical cord, the way in which we captured that umbilical cord was incredibly important to us. We wanted it to be safe. We wanted it to be cruelty-free. We wanted to ensure that the animals were being looked after. These red deer that we've used are from New Zealand, and New Zealand are renowned for having very, very strict animal welfare rules. It's also, the umbilical cord is just a birthing waste, bio waste, really, that the deer are left to roam naturally in the farms and they give birth naturally. And the umbilical cord would either be left in the field or it would be captured by the vet and thrown away into the bin. We then interjected in that. At that point, we took one umbilical cord that was after the birth of the fawn, and the mother was checked to be that she was okay. We then captured that and froze it to then use in our labs. One of the most amazing things about Calecim, I think I always tell people this, is we've been selling products now for almost 7 years. Every single one of our products that we've ever sold, that we're making now and are going to sell in the future, have all derived from that one single umbilical cord. So only once have we captured an umbilical cord, making it an incredibly sustainable process.
That's incredible. So you just said basically the messenger molecules are very similar between human umbilical cord and red deer umbilical cord. But there's another reason you use the red deer umbilical cord, correct? And that is because there is no known transmission of disease.
So you touched on a really good point. When you think of mammals and you think of animals that are similar to us, you may think of monkeys or you think of ape. That would be an easy option to go to. However, there is an extreme risk of something called zoonosis, which is the transfer of disease from one species to another. There was no link found between human and red deer.
So you take this umbilical cord, which is incredibly rich in stem cells, and then what do you do with it? How do you get this into your products?
You'll have to excuse me when I use this analogy. It's a typical British analogy. If you were to imagine a cup of tea, and you have a cup and you've got the boiling water inside the cup, and you have a tea bag as well. To make the cup of tea, you just put the tea bag inside of the hot water and you let it brew for a little while. You then take the tea bag out and you're left with a cup of tea. You don't have any tea leaves floating around in the tea. All of that has been captured within the tea bag. A very, very similar process happens with our umbilical cord lining. So you take the umbilical cord lining, you strip it from the umbilical cord, you then place it into a growth media. Within this growth media, the stem cells within it, the 6 billion epithelial, the 6 billion mesenchymal, will naturally secrete and release different exosomes and secretomes. So things like growth factors, things like cytokines, anti-inflammatory factors, anti-rejection factors, different glycoproteins. They'll secrete that into the media. We then strip out the stem cells and you're left with our conditioned media, which we call PTT6. That is our active ingredient that goes into every single one of our products.
Now, you just talked about stem cells and growth factors, and oftentimes they sort of get thrown into one pot. Can you briefly tell us the difference between stem cells and growth factors?
I think that they are often confused, and it's fine because they have a similar role. So if you were to think of an orchestra and you have a big band playing together, a big orchestra, it's the conductor that controls what the orchestra does. He can wave his baton and the violinist will play slightly louder, or the bassist will play slightly quieter. If you were to imagine that the conductor is the stem cell, so the conductor is the epithelial cell. And when they wave their baton, they give an instruction. The instruction is the glycoprotein, it's the growth factors, it's the different anti-inflammatory factors. It's the messaging vesicle or the vehicle that is sent to the different cell. One of the most important things about our stem cells and why they're so powerful, they were taken from a very, very young mammal. So almost 0 minutes old. So those cells are extremely young when they're cryopreserved. That means they're very, very active. They're very vibrant and they move around a lot. They're secreting lots of different proteins. The orchestra, as you will, when we're much younger, is a much fuller orchestra. There's lots of violins, there's lots of basses, there's lots of cymbals, etc., etc., etc. As you get older, you lose different parts of that orchestra. You lose your ability to regenerate your skin as fast as you could when you were younger. What we are introducing in terms of growth factors and glycoproteins is those messaging signals to the orchestra to play as if it was when it was much younger.
It's a great analogy. Now, since you talked about the growth factors in your serum and the cytokines and all of that being very active, there's a lot of discussion around growth factor serums. I listened to a scientist the other day who works for OneSkin, and OneSkin, I don't know if you're familiar with that brand, but they just came out with a growth factor serum. And they say that basically if it's not refrigerated and if it is not treated a certain way, that as soon as it's on the shelf, it's useless. What do you say to that?
I think that isn't untrue. I think if the growth factor medium isn't controlled in a certain way and is produced in a certain way, they can be unstable. One of the best ways for us to test whether our conditioning media is stable is to look at our professional serum. So our professional serum is a 5 millimeter bottle. It's about an 80% concentration of that active ingredient. And the first thing people see is that it's pink. There's a reason for it being pink other than it looking good. That pink color is a pH indicator. And a pH indicator measures the acidity of the product. So when we bottle it, we want it to be quite neutral. So it's a phenol red, hence the pink color. We want it to be quite neutral. Within this, like I mentioned earlier, there are things called proteins. And when proteins denature or degrade, it changes the acidity within that conditioned media. So if you see a contaminated little bottle of our professional serum, it's a different color. It's maybe a little bit yellow. It could be slightly cloudy. And that's because the proteins are denatured and the pH has changed. So whenever one of our doctors or a consumer maybe leaves it open for too long or introduces contaminant, it will then denature those proteins and change the pH, turning it to yellow. We then tell people, don't use your product if it's gone yellow.
But you do think that if conditioned right, growth factors can stay active for quite a while. They don't have to be refrigerated.
Oh, yeah, definitely. We're very, very proud of our stability of our products. They're stable well above 30 degrees. So that's about 90 degrees Fahrenheit. And well below, your average room temperature. You can keep them in the fridge, but you don't need to keep it in the fridge.
Now, I used to use a different growth factor serum for years, which I love, by Neogenesis. And I believe that was fibroblast conditioned media. There are also growth factor serums that are bone marrow derived. So tell us a little bit about what makes your products different. I'm sure you think that they're better. So tell us why.
I'll send over a table to you to pull up at the moment to really compare and contrast the different types and sources of stem cells. So ours is from the umbilical cord membrane. There are, like you said, from the bone marrow, placenta, Wharton's jelly, which is within the umbilical cord, but also from fibroblasts, from skin tissue itself. The one thing that sets aside our stem cells and our growth factors derived from our stem cells is the yield. So you can take the 6 billion epithelial, the 6 billion mesenchymal, and that's from the first passage of those stem cells. And the passage is when you replicate a stem cell. Stem cells are very, very unique in the way that they can replicate into the same type of cell. They can go on and on and on replicating into the same type of cell. So that is what a passage is when it replicates or it morphs into a new cell, but of the same type. So an epithelial stem cell will go through a passage and turn into another epithelial stem cell. So if you can imagine, we get 12 billion of these stem cells from the first passage, and we can go up to about 30 passages, so 30 differentiations of these stem cells into the same type of stem cell. It's just huge amounts of stem cells that we can get from our source. Bone marrow is probably the next most well known. This is also a relatively high yield, nowhere near as high. You can see on the graph, nowhere near as high as the umbilical cord lining. And you have to think, the stem cells that you're capturing from that are the age of the person that you're capturing it from. Whereas the source of our stem cells, they were taken minutes after birth and then frozen. So those stem cells are very, very young. They're not quite fetal because it has been born, but minutes old. So they have far more energy. They're far more active than potentially a 30, 40, 50-year-old person who is having bone marrow extraction for stem cells. Something very similar to that is something quite popular. Do you know PRP? Have you heard of PRP? Mm-hmm. The facial PRP. And that's when you take some blood from someone. Exactly. You take some blood from someone and then you spin that blood to separate the blood out. And then you use that back on their face. So it's reintroducing some of your own stem cells back onto your face. It's a great treatment and we know that it works and there's lots of studies out there, but you're only introducing stem cells of your age back onto your face.
Some experts now are saying that PRP is actually not all that they thought it was. And probably that is one reason, that you are just introducing your own cells, which are the age you are. And if you have any sort of inflammation, any sort of inflammatory cytokines, you're also introducing them back into your skin. So that's probably not the best to do either. Now, do you test your products occasionally to see that they really have in them what you promise they have in them? I'm sure you do.
So we have a strong base, like I mentioned earlier, of our doctors that are using them day in and day out. We have a medical advisory board, which is chaired by Dr. Mitch Goldman. He joined a couple of years ago now to chair our medical advisory board. And there's lots of work going on continuously, both in our lab and doctor clinics, using the product, testing the product. One of the main tests that we did very early on in Calecim's life is some of the in vitro studies. So talking about things like increase in skin density, so increase in things like collagen, for example, up to 600% in vitro. There's an increase in HA production, an increase in elastin production as well. All of this was done in vitro to test the active ingredient. So we wanted to work out how much exactly it was increasing. So yes, we do continually test. And we've just had an article published in the JDD, which is the Journal of Drugs and Dermatology, talking about elastin and HA production and how our active ingredients has increased it in vitro. And the results from that were really, really promising.
Do you have any in vivo studies as well? Or are these all in vitro studies?
These are all in vitro. Mm-hmm. In vivo, you kind of step over the line into medical. So you'd have to be looking at things like biopsies, skin biopsies. And that at the moment isn't something we want to do. If we can test it in vitro, and you can test it by looking at images, before and after images is great. And especially for hair, you can look at microscopic images of the scalp. If we can do that without being invasive, that would be best.
Are there any, since these are growth factors and they are active and they're signaling certain things to our cells, are there any contraindications using them, such as pre-existing skin cancers or active skin cancers?
It's a great question, and one that we're always very happy to answer. Within the 8 to 10 years of us using this conditioned media, this PTT6, we haven't had any adverse reaction to PTT6. We haven't seen any of those issues that you mentioned earlier. However, for people who do have a history of skin conditions or skin cancer, we always recommend talking to a dermatologist first. Some dermatologists will always recommend even a slight change to a skincare routine to consult them first. And we agree with that.
Let's talk a little bit about what one can expect using your products. So you talked about the initial research was based on wound care. But one using your products now, what can they expect?
So there's three main types of products that we have. We have a post-procedure, which is our professional serum. We can talk about those procedures in a moment. We have our cream range, which is your daily or every other day skincare range. And then we also have a hair care range as well. So if we think about the post-procedure care first, Calecim Professional was initially just a B2B brand. So we were just selling to doctors. And that was a great relationship that we forged with those doctors, which has led to some incredible research. Around 2020, we decided to develop into an e-commerce business as well. So we started selling online. The post-procedure product, the professional serum, is best used when in clinic, can be used at home for some brilliant results as well. But after things like microneedling or CO2 laser, you can apply that professional serum and it drastically will decrease that downtime as well as enhancing the results. So that's one of our channels at the moment that we have is post-procedure. You then have the cream range, which is your at-home daily or every other day skincare routine. One of our champion products in that is our multi-action cream. Some of our consumers have coined that a facelift and jar. That's a slightly lower concentration of our active ingredient, but that's your AM, your PM daily corrective cream. So for things like fine lines, we've also got a pigment cream, we've got a hydrator cream, and then also like an overnight mask, which we typically recommend to use alongside the post-procedure. So that's our second column. And then the third column or the third pillar that we have is our hair range. And this is what's been extremely exciting. Our hair product, Advanced Hair System, was launched about 18 months ago. And it was really born out of a very, very happy accident, as most things seem to be. One of our brilliant practitioners in the UK was using the professional serum on the scalp and noticed that after a period of time, there was new hair growth on this one client. And it wasn't just they weren't just not cutting the hair. It was new hair sprouting. And also the thickness of the follicle was increasing. So she then came back to tell us, we took it back into the lab. We had a look at why it was causing hair growth. And then concluded that within that conditioned media, there were growth factors and quite importantly, anti-inflammatory factors that led to an increase in hair growth. So we changed the pH slightly. We reformulated the conditioned media, the PTT6, to suit the scalp and to suit hair growth. And then we launched that as a hair growth product about 18 months ago. to doctors. And then about 6.5, 7 months ago, we launched it to consumers with an at-home kit, and that's just taken off. We've seen some incredible results. You don't need to be losing hair, or you don't need to have a condition like alopecia to benefit from this product. A close friend who is using it just for hair maintenance, she noticed that in the shower, she loses a lot of hair, and she's still got a full head of hair, but she's losing more and more hair in the shower, and it's not something she's very comfortable with. She started using the advanced hair system, and although she retained the full head of hair that she has, she lost less hair in the shower.
Well, that was exactly my experience. I just recently made a video on it. I have gone through bouts of hair loss in my life, which have been very anxiety provoking, but I wasn't really going through a bout of hair loss, but I was shedding more, washing my hair than I wanted to. So I took a picture of what I was losing, used the serum for 6 weeks, took a picture after, and the difference was quite incredible. So I actually continue to use it. I'm on my maintenance program now, and I'm really excited about it. But let's talk a bit more about your skincare products. So you said that the professional serum is for post-care. I have been trying it, and I have been using it with microneedling. So I medical microneedle once a month, and I have been using it after that. So you wouldn't say this is something to use every day as a serum. This is just something that people use when they have little channels for it to actually penetrate, correct?
You can see great benefits from the professional serum even at home without using a device. And that is primarily because of the cell signaling pathway that's created by the knock-on effect that the conditioner media has. So if you were to imagine a long line of people and you tap the person in front of you on the shoulder and you give them a message, and then you tell the person in front of that to continue the message onwards. That is what the cell signaling cascade does. And if you were to put it without procedure on the surface of your skin, that cell messaging cascade will penetrate through the skin. The reason why we suggest using it with a procedure is that more of those micro channels can be opened, so more of the serum can penetrate deeper into the skin. And because it's a 80% concentration, there's a lot of it going onto your skin at one time. With the multi-action cream, which isn't necessarily just a post-procedure product, there is something called a trans-epidermal delivery system built in to that product. And that is basically a soluble molecule that can attach itself onto the PTT6 and draw it through the epidermal layer of the skin into the skin, which it then releases the PTT6 so it can then continue its cell messaging cascade deeper even into the dermal layer of the skin.
So the multi-action cream, I have that as well. I've been trying that. I'm a little bit confused, to be honest, how to use it, because it's not a serum, but it's not necessarily a moisturizer. So tell us, how would that be used? How would one incorporate that into their normal routine?
It's a bit of a unique product, like you said. It's a cream, but it's not quite a hydrating cream, and it's not quite a serum. We've actually found that people use it as a serum before your hydrating layer, whether you're using it alongside liquid serums like vitamin C or even our professional serum. It's more of a corrective treatment cream. If you really want to target those fine lines, you can use it in place of a serum, but alongside a hydrator.
So it can be used with other actives. It can be used with vitamin C. Can it be used with tretinoin? Can it be used with acids such as glycolic acid or lactic acid? Or are there any contraindications?
No, not at all. And you've highlighted something really important. We all know that retinols have been widely used for the last 20, 30 years, and it's a very good product to use for anti-aging and other skin conditions. The way that retinols work, it causes microabrasion within the skin to then promote skin rejuvenation. Those microabrasions over time will take longer and longer to, like aging anyway, but will take longer and longer to regenerate. What the multi-action cream does is actually works alongside the retinol, that mechanism of the retinol, to help calm the skin after the microabrasion. So you're getting the benefit of the retinol as well as the anti-inflammatory results of multi-action cream, and also the anti-aging result of multi-action cream as well.
Since your products are so active and they contain growth factors, cytokines and everything, could they technically replace some other products such as peptide products or even other actives?
We try and go for quite a minimalistic skincare routine. The professional serum and the multi-action cream, alongside our other product, have this PTT6 conditioned media. And that PTT6 conditioned media has over 3,000 of those glycoproteins. Within that 3000, you're going to have the anti-inflammatory factors, your different growth factors. We don't want to replace necessarily what people are using within their skincare routine, but if we can simplify to bring it down to just a multi-action cream alongside maybe a vitamin C serum or a glycolic acid serum that people are using, it's one, saving a bit of time in the morning and the evening because people have to apply less, but also simplifying the amount of active ingredient you're putting onto your face at the same time.
Now, just to be completely sure, because I know somebody's going to ask, so we don't have to worry about pH again with ascorbic acid, for example, or glycolic acid, which are quite acidic. That's not going to affect the growth factors.
The pH, when you apply those acids onto your skin, is absorbed very quickly, and the skin is actually naturally slightly acidic. The pH doesn't matter. It's absorbed quite quickly. It's neutralized quite quickly by the skin.
I have one last question for you. This has been so informative. How do you feel about plant stem cells?
So plant stem cells, that buzzword is kind of thrown around a lot. We don't have anything against plant stem cells. They have some anti-inflammatory factors, but they're not homologous with humans. So the cell messaging that is used within a plant's system is not going to be the same as within a human. So there is that divide between what a mammalian stem cell can message to a mammalian cell and what a plant stem cell can message to a mammalian cell.
This has been awesome, Ollie. Is there anything you would like to add?
No, nothing for me. Just to maybe loop back to the point about people with skin concerns. I'd love to answer any questions in the comments that you guys have. If you have any questions, I'd be happy to answer them. We always do suggest if you have concerns to consult the dermatologist first. And hey, maybe some of your dermatologists will know about Calecim and will rave about it, which would be great.
That's great. But yeah, if you could jump into the comments and answer some questions, that would be really helpful.
Yeah, we'd love to see some of those comments and questions in the comment section.
I hope you enjoyed this interview with Ollie. I found it fascinating. As I mentioned in this video, I have been trying the Calecim Professional Serum. I use this mainly after medical microneedling, and I also have been cosmetic needling with this once a week. I want to try it a bit longer before I give you my opinion. But as I also mentioned, I have been using the Advanced Hair Care System by Calecim, and I'm actually quite impressed. Again, I made a video on that. It is linked down below. I hope this video was helpful and informative. Any questions for myself or Ollie, please leave them down below. Any comments, of course, leave them down below. You know, I always love to hear from you. And that's it for this video. Thank you so much for being here. Until next time, bye.